Alrighty, guys, it's 4:30 on the drive home for a Tuesday. Wayne, Tanya, and Brian all alongside.
Yes.
Plus, we have an extra special guest this afternoon.
Aha.
Dr. Ryan Jennings, Chief Medical Officer at HS St. Anthony's Memorial Hospital, joins us to talk to us about what's on a whole lot of people's minds, COVID-19 coronavirus. Doc, how are you?
I'm well, guys. How y'all doing?
Doing well, thank
Not
you.
too
bad.
Yeah. Fingers crossed. Knock on wood. Everybody here is good so far.
Yes.
Well, that's the secret to this whole thing. We got to keep everybody that way.
That's right. Yeah.
We're trying.
Yeah. So how are things at St. Anthony's?
You know, actually, they're great. We continue to be blessed with this idea that so far we're not seeing that surge that everybody is talking about. And, we've seen some changes from the state as far as when they anticipate the surge. But one of the big questions that we continue to ask is, there's a difference between Chicago and Southern Illinois. We saw them get hit first. We're going to be in that second wave. And so predicting the surge is really become an art. And so we are expecting to see maybe some additional predictive models coming out to give us a better idea of, how the process will evolve in Chicago. And then as we start to deal with it in downstate Illinois, and, the great news around that is that's given us this lead time for preparedness.
You know, Doc, that does make me think of the very first thing that I should have had Brian put in a question to you yesterday. Because Chicago has the majority of the cases right now, one of the things that we're hearing from listeners a whole lot is, why are we on lockdown down here when it's not a big deal down here? Just that perception of it's all Chicago's problem right now. Is that a little bit misunderstood?
I think it is a little bit misunderstood. Part of what's going to make us successful, where some of there's two things that go wrong in the bigger city. One is purely proximity to each other, and that's not in their control, but it is something that we have control of. We can socially distance ourselves extremely easily simply because I don't have somebody living on the wall next door. One, they didn't have control over that out of the get-go, which makes that so much more important that we are paying attention to the social distancing, isolation of ourselves and our families, staying 6 feet away. So that's the first part of it. The other part of it really, though, is this concept of when the virus is most prevalent in the community, making sure that we're distanced from each other so that the only control of this virus right now is to stop human-to-human spread. And so distancing yourselves will be the key to that. And so they kind of get hit by both in the cities. So why should we be making sure that we're mindful of that so that it doesn't start to accelerate within our own community, and then we do start to see broader spread from individual contact to individual contact? And the health departments and stuff have been fantastic about, at this point, still investigating each case and those types of things. And they are spread within the community, but not broadly. And that's because we've taken all the measures that everybody's suffering through.
All right. We had also put this on Facebook yesterday, asking listeners to submit questions to us if they had some for you. Doc, do you mind if I read you one here?
Please, and I can't thank you enough, because that's what I really want to do, is try to answer the questions from the community.
Well, cool. All right. So Amanda asked if we or a loved one is showing symptoms, do we call the doctor? Do we go to the ER? What about after hours? And she says, I'm not showing symptoms, just wondering.
She's reassuring her neighbors.
Yes.
Yes.
I can't say I blame her right now, but no, the right answer really is to her first statement, which is give your physician a call to walk through the symptoms that you're having, because as we all are starting to get a better handle on the idea of what can you do for this. I love a disease that I've got a medicine for, because man, you come in and you're having plain old heartburn, and I go, gosh, here's a pill for you. Take this, and if 5 days it doesn't work, let me know. That's not the case here. There is no definitive treatment for this other than helping to support people with oxygen and things as they get too sick to be at home. So if you're able to stay at home, this is, again, so much like the flu concept of if you're able to stay at home, not spread it to others, take care of yourself with the over-the-counter remedies, ibuprofens and Tylenols and those types of things. I know ibuprofen's been under some discernment, and I'm not sure we know the answer to that, but certainly Tylenol and other traditional remedies. That's where it is. If you're not so sick that you feel like you need to go to an emergency room, you need to go to the emergency room if you're becoming so short of breath or coughing so profusely that you're not able to catch your breath, having chest pain with it, those types of things. And so your primary care doctor is a great solution. Anytime Care, the online solution that we have on our website as well as an app, is 24/7. And for questions related to COVID, they can help you walk through that, and that is free of charge.
All right.
Wow, great options.
Now, one quick question, because I know this has probably been on a lot of the listeners' mind. I was kind of thumbing through a lot of the comments. Can you reassure our listeners that there are, a lot of testing being done for COVID-19? Or there's similar testing or a lot?
That's the hot topic. As I looked at the thread from you guys, and again, I appreciate you guys doing it because it helps us to kind of look at what are the themes of questions.
Mm-hmm.
And the number one theme is around testing. So, and that's the one I really want to spend and I apologize, but spend just a couple minutes. And
no apology necessary. Take all the time you need.
There's a couple parts to testing. One is the idea of testing about whether or not you have the disease right now or not. Okay?
Mm-hmm.
So disease now or not. That's one type of testing. The other type of testing that so often gets intermingled into this conversation is testing about immunity to the disease, and that you've had it and now you're protected against it, like chickenpox, like measles, like those types of diseases where once you've had them, we can actually, or been vaccinated.
Right.
In this case, we don't have a vaccine, but we can draw blood and say, hey, this person is actually immune to this disease. They're now not going to be susceptible to it moving forward.
Mm-hmm.
So that's almost a whole different world right now, in the sense that those things are just now getting developed. You realize this thing is 6 months old at best.
Yeah.
And, how many years did it take us to come up with the chickenpox vaccine?
Mm.
So, these things don't happen overnight. And so that side of it is one side. The side that I think everybody's very, very concerned about is the question of, do I have COVID-19 right now or not? And am I potentially somebody who is walking around with the virus right now and I just don't know it, and maybe I'm spreading it to others? And the answer to that question is yes, there is testing available, but let's think about what it does when you get that test. So we'll use one of you guys as an example. So who wants to volunteer?
I'll volunteer.
Tanya
All right,
does.
Tanya's the guinea pig.
Tanya's the guinea pig. So when you call me or you come to my emergency room, let's say you get so concerned that you present to the emergency room,
Mm-hmm.
and you say, Doc, I'm worried I might have COVID, and I'm coughing and I'm running a little bit of fever and I just don't feel good, et cetera, et cetera, et cetera. And we might even, walk all the way through to the point that we're trying to find out some travel history and things, but that's not very relevant anymore because right now it's everywhere. As far as we know, it's everywhere.
Yeah.
At the end of that, we're going to go, okay, do you need to come into the hospital? If you don't need to come into the hospital, I'm going to give you what advice?
Probably Tylenol, rest, and fluids.
And
You are
self-isolate.
spot on.
Yeah.
And self-isolate.
Yes.
Stay at home. Keep a distance from one another. Follow the social distancing rules. Wash your hands, etc.
Mm-hmm.
So let's pick on one of you other guys. What's the message to you right now? Socially distance. Wash your hands.
Neither one of them want to volunteer right now.
I'm backing away.
Yeah, I could see that. I could see them backing away.
Uh-huh.
I'm being socially distant.
Yeah.
But truthfully, and not to make light of it at all, but truthfully, the advice, no matter what, unless you require hospitalization, is identical. The value of the testing comes in if you need hospitalization, And at that point, then it helps us, meaning healthcare workers, to decide on how do we appropriately isolate you in our setting, and more importantly, helps us to identify potential resources that we might need around that protective equipment that we're all talking a lot about. Like I said, last time we talked, I think we found out that now we all know what PPE means, and it also gives us an opportunity, if you're coming into the hospital, to talk about how we're working to make sure that the best resources available are being allocated appropriately. And so right now in this setting, where, again, downstate Illinois has not had the big influx, one of the strategies that we're using to minimize the use of equipment, minimize the exposure to healthcare workers, minimize the use of those very, very valuable masks, et cetera, is to offer transfer early to a consolidated facility. So the tertiary care centers, the type facilities where it's not so much that I don't have the capability and technology, it's more that if I exhaust my, if I am burning up my resources locally, I'd be better served by consolidating all those resources so that if and when push comes to shove, we're able to still have those resources in smaller facilities and be able to serve our community. So there's a lot of layers in this, and I know that's a lot to kind of digest. But testing one person to identify that they're negative right now means they're negative right now. And in fact, right now, while testing still requires more than a 5-minute test. It means that tomorrow I need to test you again. So, before we talked about the idea of stay home, don't roam. Mm-hmm. Well, a negative test does not give you a license to roam. All that says is stay home, socially distance, mask appropriately. So your advice doesn't change based upon a positive or a negative test. And neither does my treatment. I'm not able to do anything differently other than help to preserve resources for the future.
Gotcha.
Very interesting.
Mm-hmm.
Well, you mentioned one thing in there, Doctor, and that's something we get questions on, and another one came in from a listener about specifically the masks and the PPE that you mentioned. We won't get into real specifics of their, situation, but they were wondering, and you might have heard this, that, they want to know if they should be comfortable going to a healthcare office, whatever that may be, if the employees there were not necessarily wearing, or all of them wearing, masks or gloves. And they wondered, should they be comfortable in doing that? And I wanted to see what your thoughts were on that, especially in light of these newest recommendations that pretty much any contact in public is recommended to wear masks. What do you think about that?
I think you just said it. I think you just said it in that, the latest recommendations from the CDC, et cetera, are that in situations where we cannot practice social distancing, so your example included, whether it's, walking up to check in at a registration desk at a hospital or anywhere else, the current recommendations are that those folks should be protected by wearing a cloth mask. So the homemade masks, the scarves, those types of things, no matter, and it's bi-directional, meaning you should have one on as you're visiting those places, and on the opposite, that person that's greeting you should have that as well, no matter what the business is, based upon the current CDC guidelines. But that does bring the one point out that the purpose of the cloth mask and the purpose of the non-medical grade mask is to control the source, meaning that you might be, just like we were talking about earlier, that folks are worried they might be carrying it. Mm-hmm. Well, the best thing you can do if you might be carrying it is, number one, stay home and don't take it anywhere else. But number two would be then to use a cloth mask so that if you cough, sneeze, et cetera, those droplets that are associated with that are captured by your mask. It isn't directly protecting you. It is protecting others from your accidental carriage. So I know that's a weird shade of gray in there, but part of that then is keeping the medical grade PPE for situations where we know that folks are treating and caring for those that do have the disease, not just preventing spread.
Gotcha. There, obviously, with all of this, as there is with some of this stuff, Doctor, there's been a lot of what I guess we could term, because it's used so much nowadays, fake news. And we had one listener ask us, and a couple of others chime in as well, are there tests that can be done at home? People seem to think that they see this stuff online. There's not really a test that you can do at home for yourself, is there?
Well, right now, there's sure nothing that is a definite FDA-approved device to do that. Now, this is everybody's dream, and this gets to that idea of the ability to check to see if you're already immune. Because if we can prove someone's already immune, it obviously opens up a whole lot of opportunities all the way around. Unfortunately, none of those tests have, proven out. And testing aside, unfortunately, I've seen lots of different types of scams and gouging on pricing and things like that you expect. It doesn't matter if it's a hurricane, if it's an illness like this. There's always somebody trying to profit at someone else's distress, and that's terribly unfortunate. But I think you need to stick to the advice from the WHO, the World Health Association, the CDC, our local and state health departments. We're looking at all of these things and trying to evaluate them. But if you read the fine print on some of these tests and some of the things where they've not been FDA evaluated, you need to let the buyer beware there, because as frustrating as it is to have that delay of time to validate tests, if I have a test that's 50-50, well, I might as well have handed you a quarter.
Yeah.
Very true.
Yeah.
So at this point, you'd say the Effingham County Health Department is the best place to let that happen, right?
Well, they don't do the actual testing, but they're definitely a great resource to determine whether or not you need testing. And all testing is done under their direction, meaning they say this person does need tested and or not, based upon the current recommendations from the CDC. So powerful resource. I can't understate that so far, we've had great success mostly by using what we do so well, and that's everybody communicating together and recognizing that neighbor to neighbor, we need to take care of each other and socially distance.
Absolutely. Doctor, we went a little long here, but it's always a good conversation with you and fantastic information for our listeners as well.
And I'm hoping you'll keep the stream open as far as questions. We can even try to maybe bulk some of those and respond to them. Again, I think themes of the questions is the big thing. So
absolutely,
happy to help any way we can to keep people apprised of the latest information.
Well,
Sounds
Doc,
great.
we hope we get to talk to you again soon, and thanks so much for coming on and joining us on the drive home, okay?
Thank you, guys.
All right.
Thanks.
There's
very
Dr.
nice.
Jennings, Dr. Ryan Jennings, the Chief Medical Officer at HSHS St. Anthony's Memorial Hospital. Always good to talk to him about COVID-19. Well, anything, but
Great
in
info.
this case, a lot of great information. All right, we've got much more of the drive home coming up just after 5 o'clock with Greg Sapp's local and area news, in which he has. If you just heard Dr. Jennings talking, a lot of people were asking about how many tests have been conducted in Effingham County. He has that information from the health department. We'll have that for you at the news at 5 o'clock right here on 97.9 XFM and KJ Country 102.3. 2.3.